AcuTcmSchool. Yep. So I have few camera here, and two of them Mandy, and one we have Facebook. You may watch this video on Facebook and on YouTube, that on our AcuTcmSchool and our clinic YouTube as well, and clinic Facebook as well. Okay. I just see that. So our topic today, we're going to talk about what are the stages of diabetes retinopathy. Okay, yep, there you go. Just making sure that my face is going. Right, should be all good. Now you may have some sound because my computer is rolling pretty hard. So I'm so sorry about it. I hope you can still hear clearly from me. I've recorded this video as well, and I'll post it up to other platform. Okay, what are the stages of diabetes retinopathy? We talk about diabetes retinopathy overviews of it last week. Today I'm going to talk about different stages. There are actually 4 stages of diabetic neuropathy for these conditions. So stage 1 to 3, we call it non-proliferative diabetic retinopathy. Together, the first 3 stages is known as non-proliferative diabetic retinopathy. So we can shorten as NPDR. Okay, so we put NPDR. So we gonna talk about non-proliferative diabetes retinopathy, that we put it down to PDR. So PDR and NPDR. So it also called non-proliferative because it's called non-proliferative because the eye doesn't make new blood vessels during the early stage, during the stage 1 to stage 3, right, of diabetic retinopathy. So which means in stage 4, a new blood vessel begin. We talk about that in stage 4. So that is very different. Okay. So NPDR is also known as background retinopathy. So during the early stage of retinopathy, you might not notice problem with your vision, but your eyes doctor will usually be able to detect changes in your retinas. So we recommend that if you suffer from diabetes, you really need to get your eye test at least once a year. Especially you can't control like your blood sugar up and down or over the normal reading all the time. You really need to get your eye checked out. And I actually suggest, if you have a very high blood sugar reading, you should do it 2 times yearly rather than once a year. So because in the first 3 stages, you really can't feel anything. You don't see the difference. You know, the only way to figure it out is run an eye test, and your eye doctor will be able to tell you Hey, you have some change, you know, in your retina, and you actually got retinopathy, but it's on a very early stage. So then you take action and do some change and get some treatment, you know. So prevented progress to stage 4, because when it comes to stage 4, it's much difficult and it causes blindness, you know. Once you see some different change in your eye, in the vision, and that is more serious. Okay, all right, let's talk about there are three different stages, the early stage, okay, of retinopathy. The stage 1, we call it mild non proliferative retinopathy. That means the tiny blood vessels in the retinas swell, and some may start to leak. So this is very early stage. Uh, it hasn't leaked yet, which means the vessel has not been damaged yet. Not damaged, not damaged that completely damaged that become leak. Leak of what? Talking about bleeding. Bleeding. Okay. So there is no bleeding or start to bleed a little bit. So what happened is a vessel is just like a pipe, you know, as you can see here. It's like a pipe, you know, like a tube, right? When it bleed, it normally swell first, which means there is pressure in it. There is pressure in it. Okay, so in Chinese medicine, we have medicine, we do acupuncture to release the pressure. That's one thing. Second thing is we when we get treatment, we help the blood flow. The blood flow is circulate, right? It go that way and then it come back again. You see, they circulate. When there is blockage, we call blood clots, stasis. Saying that they build up a lot of pressure and it swell up. It swell up, then what happened? The vessel damaged, broken, and it start to leak. Okay, so this swell up is the main one. So how do you know that it? You won't see any different. You don't know any different. This only be able to see it under our eye test. So that's why eye test is very important. Stage 2, moderate non-proliferative retinopathy. So it means blockage begin in some blood vessels. Usually there is leakage from blood vessels. That means that the blockage is start to firm, it start to get bigger clots. Well, in the first stage, there is some clot, but it's not completely blocked yet. But in the moderate stage, stage 2, it block even more. Then the vessel leak, broken, and it bleed out more, and you can actually see quite clearly that the blood vessel is leaking, it's bleeding. Okay. Stage 3, severe non-proliferative reactive retinopathy. Blockades are more widespread, causing part of the retina to be cut off from blood flow. So that means it's completely blocked. It becomes bigger, it completely block the blood flow. It cut off completely. So as blood flow is lost, this part of the retina can become damaged. So what does the vessel going to do? It actually, the function of the vessel in your retina is actually provide blood circulation for your retina to narrow the retinas, so it can provide the vision the function properly. So now in the stage 1 and stage 2, you can still get the nourishing blood supply. In stage 3, completely block. What happened? Now, retinal couldn't get any blood supply and nutrition, so it start to get damaged. Okay, so I hope that makes sense. It's so simple, right? This idea is so simple. I'm just sharing that my knowledge with you, so you know what's going on. And so once we understand that, as a patient, if you're a patient, once you understand that, you know why we need to get what sort of strategy and treatment you need. What we're doing with acupuncture and Chinese herbs. So if you're an acupuncturist, you're watching this one, and you know why. Again, you know why we put acupuncture needle. You know why we need to use herbs for this case. And once you know what's happening inside, then you know, okay, well, a heat treatment would help, or sometimes a cold treatment would help stop the bleeding, right? So in different stages, you have a different strategy for it. And why we let the blood out? Because we want to release the pressure, and because a block there, and then the blood stay in there, you can't get it out. So bleeding, but it's another good type of treatment, but you don't use it for all the patient. You need to know what signs, right? When to use it. So let's talk about stage 4, proliferative diabetic retinopathy. So we call it PDR. So in PDR, we also call it advanced retinopathy. So it occurs when new abnormal blood vessels begin to grow inside the eye. So why would the abnormal why would it grow new blood vessel? Because when it comes to stage 3, it completely blocked the vessel. So when the retina loses nourishment, it hasn't got any nutrition come to supply to retinas. So it actually signals the body to grow new blood vessels. So the body will grow new blood vessel. This abnormal vessel may also grow into the center of the eye. That is the problem. So new blood vessel, the abnormal blood vessel, it shouldn't be there, but it grows extra. Just like the pipe is blocked now, right? With it, it's blocked now. So, how do we get the pipe over here to this part? So we can connect one thing to this one, right? So this is what happened. The new one grow because it blocked over here. The new one grow from here to here, so it can continue the supply the blood to the retina. I hope that makes sense. It's very simple to understand this. But the abnormal one, the new one grow, it cause problem. It may grow to not too many, and it grow into the center of the eye, and that cause what? It cause vision problem. Also, the new one is very fragile. It's not as strong. So once you have a lot of blood supply go through, it actually bleed again, it broken again, it damage it. Okay, so we're going to talk about that now. This change can cause vision loss in several ways. Okay, number 1, the new abnormal blood vessels leak easily. Why is that? As the leaking blood vessel outplays healthy one, right? The retina gets even less nourishment. Look at that. Leakage, number 2, leakage of blood into your eye can make it harder to see clearly. right? Because there's more blood when it's leak, the new one bleed as well, there's more blood to come out. So it actually make you harder to see. It actually make it worse. Okay, and it's the new blood vessels try to cover, try to help, but it actually didn't help properly. It actually make it worse. Okay, and in some cases can block your vision entirely. Now, if the new blood vessel, it does do the work, it doesn't pump up more blood, doesn't leak more blood out, that is very good, and it doesn't actually go into the center of your eye, and that's perfect. That's perfect. That it did its job. But majority of the most of the people, when they get new blood vessel, because it's new, it's very fragile, and it need to go through a lot of blood there, and it can't take the pressure, it leak again. So I hope that makes sense to you. So then what happened with the leaking? It damaged the retinas, and then the retinas need to heal itself, and when it heals, and the blood vessel as well, it forms scar tissues. So scar tissue can form on the retinas, and that damage the retinas. Scar tissue is not good. It stops even more blood going to your retinas to narrow it. Okay, and it become more pressure. Minor bleeding can cause symptoms like dark spots and lines in your vision. So there's some dark spot in there or lines. Major bleeding can cause severe vision loss. This can include blindness or the total loss of vision. So it is important to seek treatment. If you have diabetes and notice change in your vision. What's the early change? If you're diabetic, spots, or like seeing cobwebs, the black spots, we call floaters, like you see mosquito flying. So normally you see it more when there is a white surface, like the white wall. You look at that and you see, oh, there is something flying around there, you know. But you have a look, oh, there is nothing, no mosquito, no little flies in there. It's just you can see it, you know. It may not be there all the time. More clear when you look at the sky, the ceiling when it's white, and you can see it more clearly. Okay, if you look at the flowers or green, you may not see it. Okay, look at the whites, you may see it clearly. And yeah, you really need to get it checked out, because they are the web cobwebs and floaters are the early sign of retinopathy. So if you have if you suffer from diabetes, you really need to go and get a check. Okay, so even if the problem seems to go away on its own, treatment is critical to prevent more serious vision loss from happening in the future. So as I said, once you have sight and once you're early stage, like the early 1 to 3, you haven't seen any different yet, but the test the eyes doctor has figured out that is damage, early stage, or swelling in the blood vessel. And what you need to do is get some treatment done. So for us, our clinic in Hamilton and Auckland, we'll be able to provide you the treatment, but we also want to have a look on how you manage your diabetes, because really treating that provide you treatment, we want to treat your diabetes as well. And as I said previously, diabetes, especially type 2 diabetes, with type 1 diabetes, if you suffer from that, we'll be able to help you to get treatment on your eyes. And we can't promise that we can fix your diabetes, but with type 2 diabetes, it actually a very good chance to get you treatment, to show you how to eat properly and how to lower the stabilize the blood sugar, and then eventually we'll be able to help you get rid of the medication for your diabetes, okay, or insulin, because this is what we aim for. To treat your eye problem, we need to know it actually comes from diabetes. We need to fix the diabetes. We need to get the blood sugar stable first, and then work with the GP. And one, we get the for the acupuncturist, this is very important when we treat this, or for patient, you need to understand, we don't just provide you the acupuncture. We do herbs, we do acupuncture, and I want you to get the blood sugar reading every day, so we can see the change. So you still take your get your insurance, insulins, it's not insurance, insulins, like injection, and you still do your metformin, take metformin daily, on those drugs. Under those drugs, we give you acupuncture, we give you Chinese herbs for weeks or months. Then we look at if you still over, like if your blood sugar reading every day is over 15. That's what we currently from one of our patient. He was under insulin that was about 15, over 15, unstable. Sometimes every time's over 15, and then it cut down to 12. Most of the time over 15. So we treat it, we give acupuncture and Chinese medicine, and it dropped down below 15 most of the time, and then keep going. It reached 10 and below 10. That's fantastic. And now just it can go down to below 6. That's normal. So what happened then below the 6? Then cut down the medication, metformin, cut down insulin. Well, how to cut down insulin and metformin, we refer back to the GP, and the GP will tell him what's the right way to cut it down. And the GP will look at the chart that I get patient to take every day, so we can see the progress. Once we get that, it means that the sugar in the blood is not so high. So when the sugar in the blood is not so high, it won't damage the vessel in your eye. So therefore, it treats the eye issues. Now we have needle that we can do with herbs. We can help the circulation around here, and we can do needles that reduce the blood clots, and herbs reduce the blood clots, so unblock the vessel. So on the stage 4, it blocked. On the stage 3, it fully blocked. Stage 3 fully blocked, and so in stage 4, it grow new vessel, right? So how do you prevent a grow new vessel? Because the new vessel is unstable, it's very fragile. It will damage and bleed more blood, and a new vessel need more blood as well. So it take off the blood from the old vessel. So what we have herbs, we can do acupuncture to unblock the old vessel, and then to get more blood flow. That's one. And then to heal the old vessel because it's broken, to heal it because it's been damaged, to heal it properly. So you can still use the old vessel rather than grow new vessel. So that is what we aim for. I hope that makes sense when it comes to here. We know what's going on in this case, right? So we have herbs, we have acupuncture, needles, and point to choose toward for that. Okay, now I hope that makes sense to you. If you are a patient, you suffer from diabetic retinopathy, it doesn't matter what stage, we can help you. Just call us, our details is down there, email us, our details down there or up there. We'll be able to help you. If you are quite far away, now we do what happened with acupuncture treatment. You come in, you stay here for 1 or 2 weeks, and we give you daily acupuncture, and then we give you herbs so you can go home and take the herbs. In 3 months or 6 months, you come back again. You know, if you're local one, you're a local patient, you stay here, you come in for 2 or 3 times acupuncture weekly. For the first 1 or 2 months, once you get result, we cut it down. We cut it down to just once a week or twice a week. Slowly cut it down as you go to maintain the results, and with Chinese herbs as well. And we also show you how to do the acupressure point. So you do acupressure point every day at home. So that's important too. So no one will teach you that, but we teach you that. Okay, there's a lot of things you can do. Then how to eat a diet. In your diet, what can you do? What can you do to eat healthy that would help your eyes? So according to Chinese medicine. Okay, well, that's it for today. If you want to prevent that, go for a progress into blindness, and we can help you. Okay, if you're an acupuncturist, please let us know, and you can join our online course Acupuncture Super Team to learn more to help your client. Right, stay awesome, and I'll see you tomorrow. Bye bye. Record.